Thank you for coming today.
Thank you.
Please introduce yourself.
My name is Jin. Currently, I'm a PGY2 internal medicine resident at Wise Memorial Hospital at Uptown in Chicago.
And where are you from?
I'm originally from South Korea, so actually I was a family physician there, but because of the family issue, I moved to America right after my residency in Korea. Now here I am.
Who was your role model growing up?
My father, he was not in the medical field. However, he has had worked in the same field for the 30 years. So he's the one who taught me whatever you do, do your best. And he taught me about the punctuality and responsibility, resilience. So yeah, he's the one who taught me a lot of qualities that I needed. So yeah, I would say him.
What specialty or subspecialty are you in, and why did you choose to go into that?
Sure. So in Korea, I finished my 3 years of family medicine residency, and the reason I chose family medicine residency in Korea was I thought I want to be like pacemaker, like this project. So I want to be their friend and person who can get along with their journey from their youth, from their death. So that was the reason why I chose family medicine in Korea. And here, so during my family medicine residency, the part of internal medicine is kind of half of it. So I thought I need a little more deeper understanding so that I can become more better doctors for my patients. So that was the reason. And after residency, I'm thinking to apply for the specialty. Right now, I'm thinking sleep medicine, but we will see what happens.
In your opinion, what are some traits that make a good healthcare professional?
Becoming a doctor, we should study a lot of things. However, after becoming a doctor, what I felt is we should have very compassion and empathy for my patients. So I'm trying my best to take care of them as one of my families. Good communication skill is essential because we are dealing with various people from various society, socioeconomic status, and a lot of races or countries. So taking care of their health problem is not just reading. It's not like just reading a book. So that's what I felt after becoming a doctor. So I think good communication skill, compassion, and empathy, and also motivation. Those are things are very important for becoming a good healthcare provider.
Speaking of motivation, what are some things that motivate you?
Of course, my patients. They're having their most difficult time with me. So, and I'm really happy to be with them during their very lowest time, so that I can help with them with my knowledge that I've studied, and also I can bring their some resources so that I can help them.
What aspects of practicing medicine do you find the most challenging versus most rewarding?
I'm having very, big difficulty to just get approval from the insurance about the medication I've learned from medical school, which is very essential to patients. So, to be honest, I didn't expect that before starting my training. So that was a big challenging. Oh my God, I don't know what to say, but I hope we can find a way so that our patient can get medication easily, what they need. And most rewarding thing, whenever my patient came to me, I really appreciate your help, and yeah, just one sentence that makes me rewarding. So yeah, my patient's word. Yeah.
How do you build trust with patients in your care?
What I'm trying to do is seeing them as a human being. So when you practice medicine, sometimes we are just focusing on numbers or any studies, result. And sometimes we are doing that, to be honest. However, once you start seeing patient as a human being, it's a totally different story. Now you can understand what difficulties they have. It may not relate it to medical stuff. However, sometimes it could be money problem or family issue or their belief, their religious background. So when I start seeing them as a human being, it's a really different story. So it's really difficult, but I'm also trying to learn from my patient too.
Do you have any special tips or tricks when it comes to caring for these patients?
Yeah, I'm trying to figure out what their interests, like dogs or what what they would like to do during their free time, and trying to make a trust from those kind of tips. And after that, they're giving me more trust. I saw that by myself, so I'm trying to get some clues about their personal life.
And what is one piece of advice you have for aspiring healthcare professionals?
At the oncology clinic with Dr. J, we started to award our patients to encourage just having a good treatment result is not just the only reason they are getting congrats or compliments. So we are giving the award to patients who have shown resilience or endurance. So I think for healthcare provider, that kind of attitude would be very helpful during their journey as a healthcare provider.
Thank you so much.
Thank you so much.